This topic is genetic disorders. The field of genetics involves genes and traits that are passed from one generation to the next. This process is also known as heredity, and it occurs when a single egg is randomly fertilized with a single sperm, as seen in the image here. 23 chromosomes from the male pass to the now fertilized egg, which has 23 chromosomes from the female, making a total of 46 inherited chromosomes. This is referred to as the diploid number of chromosomes, which then combine to create 23 pairs of homologous or matched chromosomes that will replicate as the cells divide. These paired chromosomes are known as sex chromosomes, or the X and Y chromosomes. The first X chromosome is inherited from the female, while the second X or Y is inherited from the male. Two inherited X chromosomes determine female sex, while an X and a Y chromosome determine male sex. Two terms that are used in genetics are genotype and phenotype. Genotype describes the actual genetic composition of the chromosomes, and phenotype describes the physical characteristics that can be observed, things like eye color or hair color, which are expressions of the genotype. Chromosomal abnormalities may result in congenital abnormalities or reproductive loss. These abnormalities normally occur during mitosis or meiosis when the cells are dividing and errors in replication occur. Mitosis is the process of chromosome duplication and results in two exact copies of the original cell, which are diploid or daughter cells. Meiosis only occurs in the reproductive cells, specifically the gametes, which include sperm and ova. Instead of making two copies, only one of each chromosome is made, which contains half of the genetic material of each parent cell. This is known as the haploid number of chromosomes, 23. A karyotype is a complete set of an individual's chromosomes. You can think of it as a chromosome map. In the image on the left, we can see a normal male karyotype with an X and a Y chromosome at the bottom right corner. In the image on the right, we can see the normal female karyotype with two X chromosomes in the same position. Now let's talk about gene mutations, which occur when there are random changes in DNA sequence of a gene. When a mutation occurs, that mutation within the DNA sequence is copied every time the cell divides. As a result, each new cell now contains the DNA with mutation. Even though the mutation remains, it's not always expressed. It just depends on where the mutation occurred as to whether or not it will be silent or cause a pathological condition. Gene mutations may be inherited from parental chromosomes or acquired after conception, like from environmental factors, including exposure to toxins. As we said earlier, not all mutations are expressed and observable. Some have no impact on the client's health. Whether or not the client is affected also depends on the pattern of gene inheritance. For example, if only one gene from sickle cell disease is inherited, then the individual would be a carrier for the trait but not actually have the disease. But an individual who inherited two genes, one from the male and one from the female, would have sickle cell disease. Autosomal dominant genetic disorders occur when the abnormal or mutated gene overshadows the normal gene, so it only requires a single gene from either the male or female for the offspring to inherit the disease. These types of disorders affect both males and females. In this image, we can see a Punnett square, which shows us all the different ways that the gene inherited from the male and female can combine. The capital A represents the abnormal gene, and the lowercase a is the normal gene. We can see that all three of the boxes that contain one or two of the capital A's would cause the individual to inherit the disease. Only the box with two lowercase a's or two normal genes represents the individual that would be unaffected. Examples of autosomal dominant disorders include Marfan syndrome, Huntington's disease, neurofibromatosis, and hereditary breast or ovarian cancer syndrome. Autosomal recessive genetic disorders also affect both males and females, but an individual must inherit two copies of the recessive gene for the trait to be expressed. This image shows a diagram of a pedigree. We can see that within the first generation, both parents are carriers of the recessive gene, the lowercase d, and only one of their two offspring inherited two of the mutated genes and subsequently expresses the trait. Examples of autosomal recessive disorders include cystic fibrosis, galactosemia, sickle cell disease, Tay-Sachs disease, and phenylketonuria, or PKU. X-linked inherited genetic disorders are caused by mutations of the X chromosome. Remember, females inherit 2 X chromosomes and males only inherit 1. They're XY. If a female passes an affected recessive X chromosome to a female offspring, the other X chromosome, which is normal, will compensate and the individual will show no signs of the trait. However, if the recessive X chromosome is passed to the male offspring, there's no other X chromosome to compensate and they will express the trait or disease. This is why males are affected more than females. If the affected X chromosome is dominant, then both males and females will be affected. But females may experience a lesser form of the disease because they have another X chromosome that is normal and can compensate to some extent. Examples of X-linked genetic disorders include Duchenne muscular dystrophy, hemophilia A, Fragile X syndrome, Wiskott-Aldrich syndrome, and colorblindness. A risk assessment is used to help identify clients who are planning to conceive and may benefit from genetic testing. This helps to identify the risk for having a child with a genetic disorder and includes women over the age of 35, a family or personal history of genetic disorders, 2 or more spontaneous abortions, if the maternal client requests testing, or if there's a teratogenic risk, like in the presence of a sexually transmitted infection or substance use disorder. For these clients, we will encourage them to consider a genetic referral and prenatal testing, and review their genetic pedigree to further identify risk. If genetic testing is indicated, then a DNA analysis can screen for potential abnormalities. Other diagnostic tests include a hemoglobin electrophoresis to confirm the presence of sickle cell trait, and serum hexosaminidase A activity to identify Tay-Sachs disease. These tests can be performed by the healthcare provider during prenatal exams. Newborn screening tests can also identify conditions that may impact the newborn's health or survival, like PKU, phenylketonuria, which is caused by a defect in the gene that encodes an essential enzyme responsible for breaking down proteins. PKU can cause intellectual disabilities for affected individuals. The goals of genetic testing and newborn screening are to provide information to help with informed decisions, predict the risk for illness, and provide early diagnosis whenever possible. When caring for a client who is receiving or has received genetic counseling, the nurse should act as an advocate for the client and provide emotional support. These clients are unlikely to be prepared for the information they are receiving, so they may feel stress, grief, and fear of the unknown for their child's future. Coordinate with the healthcare team to identify resources and recommend referrals when indicated. Focus on family-centered care and involve the family in genetic counseling process when requested by the client. Encourage autonomy and informed decision-making by teaching clients about genetic disorders and their implications, and then support the client in the decision-making process. Once the client makes the decision, respect their personal choices. Assess the client's perception of the diagnosis. Do they understand the information that they received? What is their response to the information? What resources do they need to help make a plan? And lastly, provide resources for support groups to help the client improve their understanding of the genetic disorder, learn coping strategies, and feel supported while they navigate the future with their child.